see she's joining now.
Okay, super.
Okay. So I want to, let's welcome everyone to our November Lunch and Learn. We are starting a 2-part series partnering with Liberty Dental. And today we're going to talk about the Be Well part of the sessions. And I'm going to introduce, we have 3 speakers today. We have Stefanie Gaspard is a registered dental hygienist and the Community and External Affairs Liaison for Liberty Dental. Janet Musto is with Case Management and has been with the Liberty Dental team for 5 years. And then we have Maria, I'm not going to introduce her I'm not going to say her last name. And she is a member services supervisor. So maybe you can go ahead and start.
Sure, I'll share.
And share your screen.
Can everyone see my screen?
Yes.
Okay. So thank you for the introduction, Dina. And thank you for everyone joining in on the call today. I'm sure I have a varied audience, whether that be parent, caregiver, maybe some dental professionals, or just someone that was intrigued by the topic. So thank you everyone for joining. You know, just to kind of touch on a personal note, this is kind of near and dear to my heart, where my niece has a disability, and dental was really difficult for us and trying to navigate around those, especially when you think about sensory issues. So, you know, she's turned 10 on Monday, and we've seen such progression, and she's really done a great job at kind of understanding that this is part of her healthy habits, just like she washes her body every day, just like we're hopefully eating a healthy diet, just like we're moving our bodies as part of our healthy habits and routine. And I think that's something that I kind of want to convey today. So with regards to this partnership, we're doing 2 webinars. The Be Well component is today, where we're going to talk about various things, how it affects the IDD population. But I definitely still want to hone in on the fact that I want parents and caregivers to understand how important, hopefully, their home care is to them, because majority of the times those are the people that are actually providing that care. So making sure that we understand the why, how our body function, because sometimes I think medical and dental seem to separate, and they're really synonymous. So making sure that we think about, when we think about our oral health, we think about our whole body health. All right, so let's begin. Great. Oh, forgive me, hold on 1 second. All right, so what was lovely is, and what I love about this partnership is being able to be part of a partnership with ARC. I love the awareness initiative that was launched with Be Prepared, Be Counted, Be Heard. And we got to see a lot of that in regards to our advocacy day, and hearing all the panelists and their stories. I really feel that moves the needle for change, and I'd love seeing it. So in regards to that initiative, we're kind of launching that Be Well component, and then we'll actually do the Be Smart component in webinar 2. So just a quick overview of what I want to kind of hone in on and discuss, which is statistics, oral health challenges, importance of oral health, healthy versus disease, what does that look like? Recommendations in regards to adaptive tools, what we can utilize, and then just overall improving our oral health. So when we think about statistics, about 32% of adults with IDD have untreated cavities. 80% of adults with IDD have gum disease. 10%, or let's just chalk it up to 11% of adults with IDDs have missing teeth, which are probably co-contributing factors to the periodontal disease or gum disease, or the cavities, right? Those with IDDs are twice as likely to experience emergencies, dental visits, compared to those without IDDs. 50% of caregivers report difficulty obtaining appropriate dental care for people with IDD. So we recognize that the IDD population is obviously very underserved when we think about dental particularly. So our goal is to partner and collaborate to bring care to this patient population and make a difference essentially. So sharing those resources, and being able to elaborate that on our webinar too, in regards to providers, treatment locations, and what efforts we're doing to try and close the gap in dental care. And it's definitely a collaborative effort. And we've partnered up with DentaQuest, who most, as you all know, is another Medicaid provider, in trying to locate those providers that are able and have the training and feel comfortable in regards to treating this patient population. So what are our oral health challenges? Okay, oral health issues are particularly prevalent amongst those with IDD due to various barriers, unique challenges, and just maintaining their oral health. So what can we do to improve that on a daily basis? So when we think about, there's a limited diet, often high in sugars and carbs, right? That increases our risk for cavities. There are sensory issues, right? That doesn't make, maintaining our oral health a pleasant experience for them, because it induces fear and anxiety, difficulty understanding instructions and cooperating during brushing. Having those medications really dry out the mouth, which then increases their risk for oral health issues. There's also motor skills and dexterity issues with their ability in order to brush and floss and do that effectively. So I kind of want to focus in on what can we do to combat those challenges. And I think, again, prevention, especially when we think about dental, is huge. So those little incremental things that we can do to minimize and improve those challenges are really helpful. All right, so as I mentioned before, we often think about, oral health not encompassing with medical. So again, our bodies, right, especially when we think about our mouth, is kind of like the international highway to the bloodstream in our bodies. So it's really important that we're removing that plaque and bacteria on a daily basis. And we don't know how it really affects us. So that overall theme is that there's a connection from inflammation and bacterial infection. And when we think about cardiovascular disease, right, that bacteria involved in gum disease can enter our bloodstream, as I said before, through our inflamed gums, and potentially contribute to the formation of arterial plaque, including the risks to heart attack and stroke. From a diabetes perspective, high blood sugar levels can worsen gum disease, and in turn can make it harder to control your blood glucose levels, therefore worsening diabetes. So there's a lot of combination of things where it's really connected. And I think sometimes we're not cognizant of that until there is a tooth pain or there is a concern. And we have to be diligent about doing that on a daily basis. Not every day is a good day, and you just kind of have to do your best. And sometimes your best is, especially if your loved one may have a bad day, like we all do, that you're only able to kind of brush the teeth with like a washcloth. But the following day, we need to be intentional about making sure that we remove that plaque from the day prior, and just make it part of a healthy habit for them. And I know that can be difficult. All right, with regards to gum disease, which I kind of touched on, I kind of want to make it in layman's terms as possible. So gums disease is pretty much, we go from healthy, right, where our tissues are happy and healthy. There is no plaque, there is no inflammation, but that progression to it is then gingivitis, which is there's leftover plaque that induces the inflammation, and then it progresses to gum disease, which is also known as periodontitis. Then there's mild, moderate, and severe. And essentially gum disease is the problem that happens when the gums around the teeth become irritated and infected. And oftentimes it's because we're leaving behind that plaque, that sticky stuff, that bacteria, and not doing a due diligence in regards to removing that through brushing and flossing. And then over time, that plaque becomes hard or tartar, and then what essentially induces the gum disease. So what does that look like, right? So we have healthy tissues, right? And they look stippled, happy, healthy. And then gingivitis, which is where the teeth and the gum meet. You can see that inflammation, that redness starting. And just think of, I like to think of gingivitis as kind of like our warning sign in regards to, okay, this is the time we need to use intervention and incorporate our oral hygiene practices and trying to improve those habits. And now, before it leads on to gum disease, which looks like that, where there's a lot of tartar accumulation, there's blood, and there's inflammation and pus, and, you know, essentially an infection. So, you know, what are we doing on a daily basis to combat that? Again, I included just what a cavity is, right? It's a hole in the tooth that happens on the outer layer of the tooth, which is called enamel. And once that's damaged due to the bacteria of the food particles, that creates an acid and eats away at the enamel. So we leave over food, that food feeds that bacteria, produces an acid, and expels out onto the enamel. And that's what it looks like. So that's why it's so essential to making sure that we reduce our sugar intake, especially when we think about snacking. You know, oftentimes what you're having snacking, you know, every hour, and then you're drinking every hour and a half. So your mouth is constantly fighting the battle of recovering. So every time we have some kind of food intake and it's acidic, it kind of like an acid attack in the mouth, and your mouth is constantly kind of recovering to get back to baseline, where it makes it a neutral and a neutral environment where it can act as a buffer for your teeth. So essentially, sometimes we don't know how acidic the things we're eating affects us. Let's say someone's like, oh, well, you know, I have orange juice every day. That's healthy. It is healthy, but it's still acidic, right? So you want to make sure that you're consuming much more water to make sure that your mouth gets to the baseline of being neutral, so that it's not constantly fighting that acid attack. And sometimes people are like, well, as soon as I have something sweet, I also brush. Well, you don't want to brush right away. You want to wait about 30 minutes, because then you're brushing essentially the acid into your teeth, which isn't helpful either. So again, sipping on water should be something that you're having your loved one do, just because it helps to neutralize the pH in our mouth. So we want to try avoid acids as much as we can. Obviously, we eat every day, but making health conscious choices about what we consume is really, really important. So in regards to reducing acidity in the mouth, what can we do on a daily basis? We can drink lots of water, as I mentioned before, chewing sugar-free gum that actually has xylitol in it, that helps to regulate the salivary flow or pH in our mouth. Eat food that neutralizes acid, like cheeses and yogurts, that will help to neutralize the acids as well. And dairy is just rich in calcium, phosphates, so that strengthens our teeth. Limit our acid consumption, especially when we think about food and drinks. Frequency in snacking and sipping is harmful, you know, to our teeth. And in making sure that we're getting to that safe neutral zone through tap water that already has fluoride in it is really helpful. And in our toothpastes, along with our rinses, and that we're making a conscious effort by brushing and flossing every day. All right, so these the next few slides are just kind of suggestions in regards to adaptive tools. It doesn't mean you need to go out and buy every single one. It's just if you feel like it would be helpful to your loved one, which I think most of these are have been helpful. So by all means, you know, check them out and see if it's worth the buy. But I've experienced most of these in regards to the Collis toothbrush, which has been helpful in regards to effective and efficient oral hygiene practices. And what I like about it is it encapsulates the entire tooth, or hugs the entire tooth as you're brushing. So you're getting, instead of just getting one side of the tooth, you're getting three. Now, the other two sides, that's with the flossing, but this just kind of allows you to not worry about turning the brush side to side, whether that's from a caregiver's perspective or your loved one. The three-sided toothbrush is the same thing as the Collis toothbrush. So it's really beneficial in, again, enhancing coverage, reducing the time and effort, improving that independency. less risk of injury and encouraging a consistent routine. There's also the hum toothbrush, which is really helpful. So it gives you a guided toothbrush. It gives you a timer function, the pressure sensor, just in case they're applying too much pressure as they brush. Ease and handle, visual feedback through an app, customizable vibration. So there's a lot of bells and whistles to this one. But I would say even if you get an electric toothbrush, it's great. And an electric toothbrush is still just a toothbrush. So, you know, maybe, you know, as far as the sensory goes, the vibration might be too much. Okay, you want to slowly start to implement it. So, you know, you'll have them hold it for a few seconds and then take it off and then just utilize it like a regular toothbrush. But you can get an electric toothbrush from anywhere from $8 to $12. And I think this one's a little under 30. But I just liked all the benefits to it, and it's really geared to those with special needs. So flossing is something we all have to do. Unfortunately, the brush does not get in between our teeth. So we're missing, so if you only brush, you only get about 60% of your teeth clean. So that's a strong 40% that we're missing in between those teeth. So that's the only way to be able to clean those areas. There is other options like a water pick, but I like the ones to the left of your screen that kind of looks like a V when you hold it up, just because it allows you to get into those in-between places a lot easier, as opposed to the ones to the right of your screen. And it kind of looks like a U, an upside down U. I like the ones to the left just because they're just a lot easier to use. And I always say, you know, only floss the teeth you want to keep, you know? So making sure that we do that in conjunction with the flossing is really essential. So here are some mouth rinses. Again, the mouth rinses, I would just say look for one that is fluoridated or has xylitol and is obviously alcohol-free, because alcohol-free will just induce dry mouth, which is something we're trying to avoid. And you can get any brand. There doesn't need to be a specific one, just to make sure there's fluoride in it to help with the cavity prevention and no alcohol. Here's a mouth rest that has been helpful, especially for those that won't cooperate or don't have or lack the motor skills to actually open. This has been really helpful. So you'll brush one side and then move it to the other side to brush the other side. So this has been helpful to caregivers being able to access those far back teeth. But obviously for the patient themselves, allowing them to kind of be a rest. Visual aids are helpful, always putting that into in their routine and in the bathroom, just kind of post it up. Obviously, there is improvising the best way you can, but it's always great to get a visual, and we're always, even neurotypical individuals are, when you stick to a routine, it just helps for better results. In regards to behavioral techniques and modification, oftentimes you want to tell, show, do is a good routine to model. Having the patient sit and the caregiver stand behind them and just do kind of like a slightly tilt to be able to brush those back teeth. And obviously that tells the patient too that, you know, when I'm getting my oral hygiene care, I sit, so that when they transition to that dental office, they remember, okay, I sit for this procedure. You know, positive reinforcement, whether that be an object or activity, you know, pause and complete brushing in increments. You don't want to overwhelm them. You want them to be a pleasant experience. They're always going to have to do it. Maintain a calm and encouraging tone. I know it can be frustrating at times as well. And give praise, especially when they do a good job. How can we improve our oral health? As I mentioned before, using adaptive tools that work for you, your loved one, giving step-by-step guidance, reducing snacking, increasing our water take is huge, creating that routine, those visual aids, positive reinforcement, just being patient and consistent. So biggest takeaways that I hope that I've gotten to convey in the short time that I've spoken to you guys. Poor oral hygiene can lead to serious health problems, including cavities, gum disease, and systemic issues, and more so than we're really aware of, especially when we think about our medical and dental So therefore, functional removal of bacteria and plaque is really important every single day. Those with IDDs often face challenges in maintaining good oral hygiene. So, and what can we do to improve those challenges? The very basic is our home care regimen and what that looks like on a daily basis. Home care strategies are essential in maintaining oral hygiene or oral health as specific to that individual. So customizing an oral hygiene regimen to your loved one's ability and capability is really important. They always say that, you know, you meet one person with IDD, you've only met one person with IDD. So customizing it and tailoring it to their need and their ability is, it will prompt them to do it more often. And then in regards to, I know we always, oftentimes when we go to the family cafes and the Nathaniel's Hopes, all those outreach events in regards to those with special needs, we're all often hit with, you know, how do I get care? How do I find my providers? And again, that's something we're gonna, you know, take a more of a deep dive into our second webinar, Be Smart. But you can, Dina will be dispensing out the link, so you can get to those links for Liberty Dental and DentaQuest. And there's ways to search for providers that specifically for those with special needs. So thank you so much for listening. I guess I will have Maria go ahead and share her screen now. Let me stop sharing.
And I do just want to mention that we will send out a copy of this presentation to all registrants, and then we're going to place the webinar on our YouTube series by the end of the week.
Great.
Well, hello, everyone. Hello, Dina. And Stephanie, I'm Torres. You don't have to say the second last name, it's okay. It's actually Tejada. But definitely hello, how's everyone doing? Let me go ahead and share my screen here. Let me know if everyone is able to see it. Okay, perfect. Let me see if I have it real quick. Okay, so this is, I'm definitely Maria Torres. I'm one of the supervisors here at Member Services Department. Here is where all the calls comes in, especially from our members, which we totally love. And I actually like this Trust Help Service Solution Care, because that's where we actually here for everyone, especially our members and also our providers, but definitely those members that are, you know, in situations, special needs. So we're definitely here for you guys. As far as when you guys call us and we verify your information and you need help when it comes for any type of specialty, especially special needs, we do, you know, we have the option to do provider search. So this is additional services that we actually have to be able to locate any type of, for example, if the special need is mild, you know, moderate, severe, if they need any type of perio services, we do have the options for general dentist performance specialties. If we're not able to verify any type of specialties that are licensed. So this is definitely one of our best options for us to locate it for you. We're definitely here for help. And this is one of our main things that we are able to search for providers. Besides this, we do have members that request a new case manager, especially for our Florida Medicaid. We do have our department, and that I know going forward, another representative will be speaking in regards to it more detail, but we do have the option. We actually, whenever we open the members' accounts, we review the members' alert, and it will let us know, hey, this member has a case manager assigned, and we are able to do follow-ups, have them being reaching out directly to them, and by sending, and of course, an email directly to them. They usually take 1 business day to do a follow-up. or we could just submit an email as far as our member services representative, send an email urgent. So if there's any emergencies going on. So we do that, have that option for member services. We also have teledental visits. So in our website, members are able to go directly and actually make that teledental appointment. So they will go directly to our libertydentalplan.com website. That will be the first thing you're going to see right in front of that page. You just have to submit your information and choose the time, the date, which makes you comfortable to switch to, to be able to do that appointment yourself. So we do that option due to the fact that sometimes offices are not available maybe next week or so, and you need it as soon as possible. So we do have these teledental visits that we could able to have our dental consultant give you a call, and they could either prescribe you any type of antibiotic or any pain medication. So this is one of an options that we do have instead of you going to the emergency room and get a huge emergency bill. We do have this option in each plan. So this is definitely something that a lot of members consider whenever they have an emergency situation. Also, we do have palliative care treatment. This is something that, for example, if you don't have an office available, or if you cannot wait for maybe teledental has an appointment maybe tomorrow and you cannot wait and you decide to go to an out-of-network provider, we do have this palliative care for emergency treatment options, meaning that you are able to go to any office, even though they're not in network. However, you do have to pay that out of pocket, and Liberty will reimburse you up to $75 for any type of palliative treatment care. Meaning that if you had a really bad pain or anything like that, and you decided to go to out-of-network office, then they will go ahead and you will pay out of pocket, and you will send us a ADA claim form with the receipt that you did pay out of pocket, and we'll definitely reimburse you back. Emergency meaning that they, as far as they did a consultation and they provide you, maybe they had to provide you medication or anything like that, then we will go ahead and reimburse you for that. So this is something that a lot of members also utilize if they cannot wait too long for any type of treatment. We also have our hospital settings, and this is for most cases when it comes for any special need situation. We do have these providers that do have hospital settings, meaning that they will need to go to a hospital to get sedation. They have any issues going on and they cannot move, or you need to go to a hospital for any type of treatment. Then this is one of the ways to go, which is our hospital settings, and of course with submissions that include the narrative of what's going on. We do need that PCP letter. Pretty much it's a medical provider letter that supports the medical condition or special need, medical condition, and the type of specialty that is needed. Meaning that if it could be either general dentist, but they need to go to a hospital settings, we do need to know and have all this information to go forward. Okay, I don't know if anyone have any questions. This is for member services, and we are here to give you guys all the services that we need and help you going forward. Thank you, Stephanie.
Thank you,
Thanks,
Maria.
Maria. We don't have any questions in the chat as of yet, so people can certainly put them in there, and I'm monitoring those.
Thank you.
Janet, and I will go next. If you can see my screen.
Yes.
So let me formally introduce myself. I am Janet Musto. I'm the AVP of Case Management here at Liberty Dental Plan. The department's about 5.5 years old. And the goal was to merge the medical and dental. So when the calls come through to Maria's department, or even with Stefanie, when these members, special need members need care and they have the dental need, is they're referred over to case management department. So I thought it'd be really good just to give a high-end overview what that setup is and what it's like and how we advocate for the member through the healthcare system. So welcome. Okay, so the case management program here at Liberty is value-based, customer-focused. So it is a collaborative service that merges the medical and dental needs, as I noted in particular at the beginning. So what do? Well, we first outreach to the member, and then we screen, assess, stratify the risk, because we put them in risk categories. We plan, we implement, we evaluate, and we do follow-up. And we advocate for the services to meet individuals' holistic needs to promote quality, cost-effective outcomes. Most of the members we oversee have our high-risk members with complex and with oral and physical health needs to overcome barriers to care and make use of their benefits. So what are these high-risk members? And the majority, I will say right from the beginning for us in Florida, I would say a good 85–90% of our members are IDD special needs members. But who else do we help? Those with complex medical or behavioral health. So it could be those that are post-transplant, because you always want to make sure they get the proper care, and particularly probably in a hospital setting. Those with IDD, which we're speaking to today, special needs, Down syndrome, autism, extreme anxiety, those type of needs. And then those with high dental service utilization, those with intensive dental health care needs, and those that consistently access services at a higher level of care. And those are our members that go to the emergency room because they don't know where else to go. And when we get the report, we outreach, we introduce ourselves in the department, but also Liberty and how we can help, how MSR can help. You know, always call us if you have a need, we can help. And then just those members that would like case management. We do not turn anybody away. We will help them and to advocate for them and get through the process of securing a provider. Okay, so what are the tools that we use when we go to stratify the risk and determine their needs? We do an oral health risk assessment. That's questions of about 12 to 15, whether it's a special needs child or adult, and basically getting the baseline of their oral healthcare needs, such as when have they gone to the dentist last, how often do they brush their teeth, is there a family risk of caries, etc. So it's about, so we can give a good baseline of their oral needs. Then we do the comprehensive risk assessment. That is the whole picture. We gather their medical information, their dental information, their social information, and any other needs they have. And if they have any other services or care in the home or that they receive out in the community. We develop nursing care plans, which is part of their dental treatment plan of care, plus developing SMART goals. What are their goals that they want to attain in the short term and the long term, and providing education on those. We also meet daily on rounds. So those rounds are multidisciplinary. So we have the dental director, we have provider relations, we have claims, we have the care team, and I'll show you what the mix of the care team is. And any members and that can help us with the care and ensuring we are providing the proper care in the proper setting for this member. What are some other things we do to get the holistic picture? We collect medical records, dental records, and we will also set up transportation if they have need that. That way we gather all the information and really ensure the kind of care they need and ensure they have the right provider in the right setting at the right time. So we pull this all together. Who is doing this? So what is the makeup of a care team? So there's the case manager, which is a licensed nurse, and our care coordinators, which are dental. Most are dental assistants and trained in the insurance industry. We have the assigned dental director, and then the internal and external collaboration. What are some of those? Well, one of merging medical and dental is we outreach and collaborate with the members' medical plan case management department. Make sure, in particular, if they require sedation in a hospital setting, that is actually paid on the medical side. So we collaborate to ensure that they can send the authorizations for approval for that, and we take care of the dental side. And we collaborate with any member's needs in making sure they are getting everything that they need. So that is a very important part, is the collaboration with the medical dental. We also, part of the holistic approach is their social needs, as I mentioned earlier. We have a program that we actually developed. It's called Community Smiles. And this is a list of questions related to, do they require any help with any social needs that are also affecting their daily care, or mental health needs? Do they just need a referral to a food bank, or financial help, or a support group, anything like that? We will help them locate it through Find Help, which is a national website. Anybody can access it. We're able to go the extra step and link into these particular social need groups to help them and send out a referral. Otherwise, we just let the members know what the Find Help website is, and they can certainly review it in their leisure and look for maybe any kind of outsourced resources they would like to have. And as I noted, it's particularly voluntary, but we want to incorporate it in their holistic approach and ensure we're addressing anything that they need. So how do we bring this all together in case management? So when the member referral comes over, we get them as noted through MSR. We get referrals directly from the providers. They get to know the department, and these providers in particular treat our special need members. They refer them over. We can see referrals from our department, our claims department, directly from the dental director. Anybody in the community, the health plans. So we receive referrals from many different avenues to help these members. We then determine their member needs, which are through those assessments and speaking with them, the member or their guardian, and then treating the whole person as noted, determine their medical, dental needs, and their social needs. And that can include their family. And we get that plenty of times. Oh, so-and-so, they have a sibling. Can you help them? Certainly, we will help them. And if they're not under the same insurance type, we will guide them to where that is, but we will help anybody with the social needs. Then we collaborate with the internal and external stakeholders as noted. So again, with our dental wellness team, with our dental director, with the medical plan, providers in the community resources, etc. Anybody can refer the members that have the Florida Medicaid and Liberty to the department. Part of that is we see the member through the whole care. We don't just set them up and done. So we actually help. If we have to look for an out-of-network provider, we do that. We oversee the claims from the providers. We oversee the pre-auths because we want to make sure everyone's taken care of to ensure this member is taken care of, and part of that is helping our providers and everybody involved. We also, once we get the treatment, we do appointment reminders. We follow up with the member and the provider. How did the treatment go? Is there any further treatment needed? If so, we will help with that. We help set up the appointments. Then, once the member's treated, we follow up with them. So, we usually follow up within 90 days after the last treatment to see how they're going, if they have any needs. And also then follow up 1 year afterwards, and then the death knows nothing's needed, we will close the case. And they can always come back, you know, when other needs are noted. So we do the outreaches there. And that is a high overview of case management. It just really brings it together, and hopefully collaboration with ARC or any other communities to really see how Liberty is helping these special needs members, and that we really work and appreciate and want to advocate for our members. Any questions?
Thanks, Janet. We have a couple people in the chat that have area specific questions, and so it may be better just to share your contact information and let them contact a member of Liberty Dental
Yeah,
directly
okay.
regarding providers, you know, in certain regions.
Okay.
Are there any other questions that anyone has for Stephanie, Maria, or Janet? You can unmute and ask a question. Looks like you covered everything. So last call for any questions or any comments. Okay, well, we thank everyone for joining us,
Thank you.
and we hope you'll join us in December. Have a great week.
You too.
So much. Bye.